Forehead reduction versus traditional hair transplantation. Forehead reduction can lower your hairline in just one day, but is it better than a hair transplantation? In this video, we'll talk about some of the differences and help you decide on what's best for you. But what is forehead reduction surgery? Forehead reduction surgery is a method to lower the hairline so that if there's frontal exposure of more scalp or temporal exposure, instead of transplanting that with hair follicles from a donor site to that area, another method is to literally move the hairline or the scalp that has hair downward. The procedure is done as a surgical procedure, and an incision is required right at the hairline level between where there's no hair in the beginning of the hairline. Then there has to be undermining of the scalp backwards, and then another incision is often needed into the hairline behind that to rotate the scalp downward after removing a certain amount of skin of the forehead. So a certain amount of skin is removed from the hairline downward, usually not in excess of about 3 centimeters. And then the portion with the scalp above that is rotated down to meet that incision line where it's sewn or stitched in place to bring that hairline downward. What is a hair transplant? Hair transplantation is exactly what it says it is. It's taking a hair from a donor site, often the back of the head where usually donor hair is plentiful, and then transplanting that hair into the areas that are needed. In this discussion of forehead reduction versus hair transplantation, those hairs would be placed in the frontal area where the balding is, or in the temporal areas as well. In those situations, we're taking individual hair follicles and transplanting them where they need to be to restore the frontal and temporal hairlines. Here are the key differences between forehead reduction and hair transplantation. One is a level of invasiveness. It clearly, the forehead reduction is a lot more invasive than transplantation. As we mentioned before, we're taking a segment of skin away between the hairline and a lower part of the forehead in a couple of centimeters, depending on how far down we want to move the hairline. So that's invasive and actually removing some of the scalp. And then another incision is required to bring that down. And then you have the stitching or sutures in place. It is invasive. But one advantage is you're getting a lot of hair moved into the area instantly. So you're getting an instant result of a lot of hair where you're missing it. However, the invasiveness is significant. The way we do most of our hair transplantations is to do what's called FUE, or follicular unit extraction, where we're shaving the back of the head to some degree so we can remove each little follicle with a particular instrument, which is very non-invasive, and then those are being transplanted into the area of the void. The contour can be made very nice. We draw a line as to where you want your contour, and we're simply transplanting the hair to fill in that exact area that you want. So it's very customized. Both can be customized, but you can do some fine detail with the hair transplantation that is not available with the forehead reduction. There can be post-operative bleeding with the forehead reduction, so we have to pay strict attention to what we call hemostasis, or reduction of blood before the patient leaves, where the post-operative bleeding possibility from an FUE or hair transplantation is very small. It might be some microbleeding, but not as much as potentially the scalp. The outcomes, of course, with the hair transplantation, you're going to wait 6-9 months or greater for the full hair growth with the individual transplantations. And as I mentioned before, the forehead reduction will give you that immediate result. So can you combine forehead reduction with hair transplantation? The answer is yes. It's not done very often, but let's say, for example, there is a certain amount of donor that patient will have, not enough to fill in the entire, let's say, frontal or temporal area, but the forehead reduction will do that. But then the patient also has balding, let's say, on the crown of the head, or wants some fill in the middle, the parietal area of the scalp. There's at least enough donor site for that at the back of the scalp. Then we can do a traditional hair transplantation and fill in that middle area while getting the forehead reduction to restore the frontal baldness. So in terms of sequencing, it is best to do the forehead reduction first, get that all stitched up, and then do the filling in of the mid portion with the hair transplantation. That way there'll be less disturbance of the forehead reduction if you do it in reverse order. So which procedure is right for you? The way to get an answer to that is really to obviously come in to see us for consultation. We can discuss further the pros and cons of each procedure, and you can make your final decision based on our discussion. By and large, though, our center tends to favor hair transplantation rather than forehead reduction.